Radiation therapy plays an important part in the treatment of cancer. This DVD was designed to introduce you to some of the processes, techniques and equipment used within the radiation therapy department and answer any questions you may have regarding your treatment. The cancer experience is distressing for patients and families. It's normal to be distressed. The team at the Palmerston North Regional Cancer Treatment Service are committed to treating you as an individual with a high level of professional care and attention. We hope the information on this DVD will give you some idea of what to expect and so reduce some of that distress. We do encourage you to ask questions as you proceed with your treatment. So let's have a look at what your radiation therapy will involve. We will also be talking to patients who have been through radiation therapy treatment about their experience of it.
I had my radiotherapy to the left side of my chest. I'd had a full mastectomy of my breast and needed radiotherapy after that.
There are a range of cancer therapies such as surgery, chemotherapy, radiation therapy and hormone therapy. Various types of cancer respond differently to different types of treatment. Your cancer specialist will advise you of which is the best treatment regime for you. The radiation therapy process begins with a CT session, which stands for computed tomography, to gather the information required to plan your radiation therapy treatment. This is needed in addition to any diagnostic CT scans you may have already had. For your first visit, you will check in at the radiation therapy reception desk. You're always welcome to have a support person accompanying you to your appointments.
Take a seat with the nurses, thank you.
The radiation therapy department has nurses who specialise in the care of patients receiving radiation therapy. On the day of your CT scan, you'll meet with the nurses. Their goal is to provide care and support during the course of your treatment. They can help with education, side effect management, access to other health professionals, and discharge planning.
Face photo on our computer.
On your first visit and with your permission, we would like to take a face photo for identification purposes. Then, depending on the area of the body to be treated, you'll be asked to change into a gown. A CT radiation therapist will explain the procedure to you. The staff will position you on the CT couch using various different aids to ensure your position is stable and comfortable.
Take the scanner up a little bit. Is that feeling quite comfortable?
For treatment to the head and neck area, a mask is usually required. A mask is used to ensure the head is in a stable position for treatment and allows marks to be drawn on it. To make the mask, it is first softened in a warm water bath. It is then gently pulled down over the face and cool damp cloths are used to set the mask.
Down now so it will set.
Okay, we're just going to take the mask off now. There might be a little bit of suction.
Laser lights that project onto your skin will be used to establish positioning and reference points for treatment. For treatment where a mask is not required, marks will be drawn directly onto the skin.
Okay, we're just going to take you into the scanner now. We'll be moving you through.
Once you're in the correct position, the radiation therapists will conduct the CT scan from the control room. This takes around 5 minutes, during which you will be watched through the window and on the TV monitor. We need you to lie as still as possible during this process. The CT scan produces images that are used to plan the radiation therapy treatment. To ensure accuracy in reproducing your setup position for the upcoming treatments, you may be marked with small permanent tattoo dots. Your consent will be asked prior to this procedure. The tattoos are not obvious and look somewhat like a small dark freckle. Your CT information will be sent through to planning. As all body shapes and treatment needs are different, an individual plan is created just for you. The radiation oncologist prescribes the dose, number of treatments, and specifies the exact area to be treated. A radiation therapist will create the treatment plan using specialised computers. Depending on the complexity, the standard planning time frame can vary from the same day up to 3 weeks. When you begin your treatment, your radiation therapists will introduce themselves to you and describe what's going to happen. You're welcome to have a support person accompany you. On one of your treatment days, it may be possible for your support person to come into the treatment room to observe your treatment setup. An appropriate day can be organised with treatment staff. To ensure you get the best possible support, please inform your radiation therapists if you experience any problems with your radiation treatment.
My partner was able to come in and have a look what they actually did. It wasn't this big scary room that you kind of walked down the hallway to and you disappeared for 5 minutes and then came out.
Well, it was 7 weeks, and when they said 7 weeks at the start, for a busy person like myself, it sounded an absolute nightmare of being that long. But once we started to get into it, and we were moving through the 37 treatments, yes, it went very quickly.
They allowed me to take my own music, so I took Fijian music, and it's a special place for my husband and I, so we love Fiji. So I had my Fiji music, and the machine was my palm tree, and my bed was my beach, and that's how I got through my treatment.
Here we are, put your basket down there, put your glasses with it. Thank you.
Radiation therapists will position you on the treatment couch in exactly the same way as you were in the CT scanner. The lights are turned down and red laser lights are matched to the marks on your skin.
Okay, so we're just going to set you up here.
Lights in the head of the machine project onto the skin and are used to verify the setup.
Keep you warm. Okay, we're ready to go now, nice and still.
Once in the correct position, the machine is moved to the first treatment angle. It is important to keep as still as possible. If you want to stop treatment because you think you have moved, raise your hand and the radiation therapist will come into the room. The machine is operated from the console area outside the treatment room. Although alone in the room, the staff are monitoring you through a closed-circuit TV camera and intercom. You may be treated from more than one direction, and often the machine will be moved by the radiation therapists from outside the room. The time the machine is on varies between a few seconds to a couple of minutes. The machine creates some noise while operating. However, you will not see or feel the radiation.
How was it?
Routinely during your treatment, you'll see the doctor.
How are things going with the radiotherapy?
I think.
Okay, so no skin reaction around the side where you're wearing the mask?
It's starting to, just beginning to.
Radiation therapy can cause side effects. Side effects vary between each individual and depend on the area of the body being treated. Unlike other forms of treatment, radiation therapy side effects are localised to the treated area. Your doctor will discuss this with you.
Comfortable, and it's also in the side of the neck. So as the time goes on, as your reaction gets more severe, we can give you some creams and some lotions to help with the reaction in the skin, and some painkillers for inside the mouth as well. Okay?
To start off with, it didn't seem to affect me at all, except that I felt tired. And as I've said, I'm usually a very busy person, but I found that I really had to take time off and have a bit of a rest. But apart from that, it was okay.
The linear accelerator creates two distinct forms of radiation, electrons and photons. An electron beam is accelerated down a linear guide and directed towards the patient. To create photons, a metal target is inserted into the beam. The machines undergo daily quality assurance testing and are serviced regularly. Radiation therapy treatment programs can vary between one treatment and up to 7 weeks of treatment. Appointment bookings are made with the consideration of many factors, due to the large number of patients receiving treatment and the number of patients from outside of the Palmerston North area. It is not always feasible to give appointment times that will suit everybody. Staff will do their best to accommodate where possible. A dietitian is available where necessary to offer advice on healthy eating, weight maintenance, nausea, poor appetite, sore mouth and swallowing difficulties, taste changes, constipation, diarrhoea and light diets. The Māori Health Unit is accessible for people of all cultures. They provide marae-style accommodation for whānau of patients who live outside the MidCentral health catchment area, patient advocates.
Most difficult part of the journey so far for you?
It's been interesting just following the course of treatment and how I've built.
A social worker is available to help in areas of support and advocacy, financial information, patients and family support and counselling, crisis intervention, linking with community services locally and in other regions.
I've been given some information about how things are going for you, but could you tell me a little bit about what the issues are that have brought you here today?
The psycho-oncology staff can help people improve their coping abilities by using psychological techniques to make decisions and solve problems, manage stress levels, reduce symptoms like pain, anticipatory nausea and panic attacks, recognise and address any fears, anxiety or depression they might be experiencing, improve relationship skills, build support networks, improve self-esteem and self-image, acquire information or decrease information overload, assist with meaning, purpose, wairua and spiritual concerns.
I'm the sort of person that thinks, well, if it's got to be done, it's got to be done, so let's just get on with it and try not to be too phased out by it. I think the strategies and techniques that I used were mainly about thinking, I need this, I just need to get this, go through it and get this this treatment finished. It's for my benefit and it's helping to not bring the cancer back. So I just tried to be as aware as I could and as positive as I could about it.
I realised that, all right, we were stepping into the unknown from the known, and I thought, well, I'd have to take it day by day and just see how it goes. And it was good to be able to talk with my wife, who stayed at Ozanam House with me, and also with other members of the family. And I think that's a significant thing, is to be able to talk to other people about how things are going.
Until I had my first treatment, I still really didn't realise how it was going to go. But no, I wasn't actually worried about the treatment in any way, shape or form until we were ready to start in the making of the mask. And then I really knew what it was about and what I needed to do to get through this.
And we tried to get your appointments on a Monday.
Regular patient education sessions are run in the department to give an overview of radiation therapy. It is a good opportunity to ask questions and learn more about radiation therapy.
Can I get transport across from Hawke's Bay?
Yes, there's a shuttle service that's been set up.
The Cancer Society is located just down from the hospital and offers a range of different support programs such as yoga,
try and keep that inhalation going the whole time,
massage, and a Look Good, Feel Better program. Other services include a Living with Cancer course, meditation services, home and hospital visiting services, Cancer Connect, a telephone peer support program, breast prosthesis fitting, breast cancer support group, lymphedema support group, a men's support group.
The one that I used off the top of my head was getting a prosthesis fitted, and that was quite a shock to me because it actually went better than I thought. I went and it actually looked okay. I was really surprised when she sort of fitted it out because I'm not a small woman, and so having having the size, even getting the size sorted out was really, really easy. And she just seemed to know what she was doing. And took one look and away we go. And what colour do you want? And I thought, oh, this actually looks okay. So I was really, really surprised at that. And, it was a service that was provided here. And the woman knew exactly what she was doing, and so that made it easy.
The Cancer Society is located throughout New Zealand. To locate the Cancer Society closest to you, call their support and information line 0800 CANCER 226 237. Many patients travel from throughout the lower North Island to have radiation therapy. Ozanam House provides accommodation for patients and their families or friends to stay while undergoing treatment. It is often referred to as a home away from home. Guests are encouraged to treat the house as their own home.
Ozanam House allowed my family and friends to stay to keep me company with being so far away from home. They were just as welcoming to them as they were to me, so that's why we found it a family environment. The facilities at Ozanam House have a room that you have with a TV and beds, and we have a shared kitchen, and so you get to meet other people that are staying at Ozanam House and their support crew, and always very positive, always lots of fun and lots of laughs.
And Ozanam House is just an absolutely wonderful and supportive team.
We hope this DVD has given you a better understanding of the radiation therapy process. The staff and service providers are here to assist you on your cancer therapy journey and make it as comfortable and easy as possible. If you have any problems, concerns or questions along the way, please don't hesitate to ask for help. That's what we're here for.